This is the Psychedelic Medicine podcast.
Hello and welcome to the Psychedelic Medicine podcast. I'm Lynn Marie Morsky, your guide on this journey, and today we're going to be discussing psychedelics, sexual functioning, and intimacy with Tommaso Barba. Tommaso is a PhD candidate at the Center for Psychedelic Research at Imperial College London. Tommaso's research is focused on understanding the potential role of psychedelic drugs for well-being. He authored the first paper on the effects of psychedelics on sexual functioning. Now, before we get to Tommaso, just a reminder that the Psychedelic Medicine podcast is for educational and informational purposes only. Nothing here is to be construed as medical or legal advice. And just one more reminder, as always, if you are a clinician and you'd like to learn more about psychedelics and how they may potentially help your patients, please join the Psychedelic Medicine Association. It is our mission to get you educated so you feel comfortable discussing psychedelics with your patients when there is an available and appropriate option for them. To check us out, head on over to the website at psychedelicmedicineassociation.org. Now, without further ado, thanks so much for joining us today, Tommaso.
Thank you so much for having me. I'm really happy to have this conversation.
I'm finally very happy to have this discussion because I know this has been in the works for a long time. You told me that the paper was going to come out, and then when it came out, I was finally so excited we could have you on. We met years ago at the Insight Conference in Germany, and it's always cool to have how many times our paths have crossed despite the fact that you live halfway across the world.
Yeah,
But
quite a few times with a lot of funny parties and.
very true. Had many fun nights across many different countries with Tommaso, and so I'm very psyched that we get to finally do the podcast thing after all this time. So, and your research has been everywhere because it is sexy. Like let's just call a spade a spade. People love sex, and so psychedelics and sex was a natural. People love to talk about psychedelics. People love to talk about sex, and I think what we're catching on to in our society is that sexual functioning is not a given, and it's something that we
Mhm.
should feel okay saying, hey, let's look at some options to increase that functioning, and also likewise with intimacy. And so if you could start by telling us a little bit about what got you interested in going down this avenue of research.
Yeah, absolutely. And it's been quite funny and interesting because it's probably becoming like the main scientific topic for which now like I'm making my name on. And it was kind of like collateral project and not something that it was really meant to be part of my research path when I started to be here at Imperial. And I have a background in working in psilocybin for depression, and I have quite some work around that and like the interaction between psychedelics and SSRIs. And then I still moved into some clinical work further in fibromyalgia and chronic pain. But I always had this thing in which like I had several conversations with one of our colleagues, Bruna Giribaldi, that she was the main trial manager in the trial where we compared psilocybin versus escitalopram from depression that was published a few years ago, that has been for long fascinated by this link between psychedelics and sexuality. And she was the person that initially kickstarted this because she ran the trial before I joined Imperial, and she decided to insert some questions in the trial around people's sex life because she thought it was a very interesting thing to investigate. And back then, we were also running some big survey data studies looking at the impact of naturalistic psychedelic use around the world. And we were curious to examine the impact of psychedelics on people's sex life over there too. And so like we ended up with these two very interesting data sets in which we had before and after changes in people's sex life after major psychedelic experiences. And in a study that was more uncontrolled and more on healthy people that were consuming psychedelics for well-being related purposes, I would say. And the other study was smaller but done in controlled setting and was comparing psilocybin as a therapy for depression to the leading SSRI, escitalopram, that is commonly known as Lexapro. So yeah, at this point, we quite had a lot of potential to kind of look at this data that for some reason no one ever took charge of. And they were a bit buried into the massive amount of unprocessed data that we have in our lab.
I love that the massive amount of unprocessed data. I cannot wait for the upcoming years of things that will come out of that unprocessed data. And I'm glad that this was something that you chose to look into. So let's start, if we can divide them up. Let's start first by talking
Yeah.
about the data that came out of the escitalopram study. So giving us just a little bit of background, you were comparing psilocybin versus escitalopram, like you said, which is Lexapro,
Mhm.
for depression, correct?
Yeah, yeah,
Okay.
and this was a big clinical trial that was run by Professor Robin Carr-Harris when he was here at Imperial, and the idea was building up on the evidence that we produced back in 2016, in which it shows that psilocybin accompanied with psychological support was leading to long-lasting improvements in depression, and we wanted to see how psilocybin treatment was comparable to first-line treatment for depression like SSRIs. And so we ran this trial that compared 59 patients treated with either escitalopram or 2 doses of psilocybin and the same amount of psychological support. So we had around 30 people randomized in the psilocybin arm that took 2 doses of 20 milligrams of psilocybin, that is around like 5 grams of dried mushrooms, to give like an estimate to people, accompanied by around 20 hours of psychological support, together with 29 people in the other arm that were administered the 6 weeks course of the SSRI escitalopram, together with 2 placebo-like doses of psilocybin of 1 milligram and the same amount of psychological support. So at the end of the trial, we wanted to see what was the differential impact of these two treatments on depression. And what we found was that on depressive symptoms, the two treatments were almost comparable, even if psilocybin like showed some level of additional positive effects. So like in the main outcome that we had in the study, the two treatments were comparable, but on other measures of depression that we included, psilocybin outperformed the escitalopram. But the very interesting thing that came out from this trial is to see how like the effects on well-being that were driven by psilocybin were much more impacted by psilocybin than by escitalopram. So despite these two treatments were, I would say, quite similar in reducing negative symptoms of depression, such as sadness, when we looked at the positive affect symptoms like well-being, connectedness, ability to feel emotions, and so on, were impacted by the two treatments, psilocybin outperformed escitalopram. And given so, like we were really curious to investigate further the sex life of these patients, because I would say an active sex life is a key component of people's well-being, and a very overlooked one.
Absolutely. And I think it's interesting that you studied it as part that this came out of that trial that was comparing psilocybin to escitalopram, because as an SSRI, which that is, SSRIs are known to have somewhat of a kind of a reputation for having some sexual
Mhm.
side effects, correct?
Yeah, yeah, and it's one of the most common reported side effects of SSRIs, and it's due to some downstream effects that the increased activity in the serotonergic systems that SSRI induce are negatively impact sexual functioning, because if there is too much serotonin in your system, your sexual functioning tends to be inhibited, especially in the levels of arousal and capacity of having orgasms and so on. And so, by taking this tablets every day, people report sexual dysfunction very frequently, and it's around 40% of people, with some studies showing up to 70% of people reporting this. And there is a lot of like incongruences that they appear to be believed to the fact that it's still a very like stigmatized topic to discuss with your doctor, and a lot of people tend to not report sexual dysfunction as a side effect of medication until they are explicitly asked. And this is something that we found in our trial, where we asked people for side effect they were reporting. We didn't have many people reporting the sexual dysfunction, but then when we asked in anonymous questionnaires that we collecting over the course of the trial, then patients reported it much more, and this was quite interesting as an observation.
Yeah, it's very interesting because, as you said, in a lot of the ways that you measured, escitalopram and psilocybin looked equal. But if you're imagining what this looks like in a person's life, if they have the choice if all other things are equal and one helps sexual function and one impedes sexual function, it seems like
Mhm.
that would make a big difference for a lot of
Yeah,
people in their
yeah,
day-to-day
yeah,
life.
yeah, absolutely, absolutely. And I think like this adds to the fact that SSRIs like are also known to induce in some cases this sort of emotional blunting that I would describe it as like the reduction of the intensity of emotions, either positive and negative, that people can feel in their everyday life. So like they might be like I would say somehow protected by the depths of negative emotions that depression is characterized by, but at the same time, they also don't get the highs that they were normally used to get. And this can then, like, I would say, impact the sexual functioning aspect of people's life too. So, on the contrary, psilocybin really appeared to like reopen people to the full spectrum of emotions that maybe normally they were suppressed or they were not allowed themselves to feel. So these results that we got on sexuality kind of plays in this role, and now I will explain a bit better on what we actually found.
Yes, please do. Yes. What came out of the mounds of data that you that you saw through?
Yeah, so what we found was that people treated with psilocybin reported improvements in sexual pleasure, in capacity to communicate in their sexual desire with their partner, in sexual arousal, sexual satisfaction, and similar components of sexual functioning. While people treated with escitalopram did not report any of these changes and tended to report a deterioration in this aspect of functioning. The only aspect of sexual well-being that improved in both groups was the satisfaction with people's body, and this was likely due to the amelioration in depressive symptoms that then resulted in an improvement in body satisfaction. But that was the only one. So yeah, we found out that overall these two treatments seem to have quite different effects on these aspects of sexual functioning.
And how far out were the patients followed and asked that same question?
Uh-huh. We asked it like at the main trial endpoint that was 6 weeks after the main experience. And so it's not really far in time. We have now data that are under review on the 6 months trial, the 6 months follow up on this trial that will likely be published later this year. But yeah, I can share much on it, but they're going to come out soon
Okay.
in the
Very
next
cool.
months.
Very nice. Well, we can always do repeat episodes. Love to have you back. Okay, just setting that up, just in case you wondered. So now let's, unless there's any other specific things you want to mention from that pullout, we can move on to the survey. Let me know.
Yeah, yeah, no, that's perfect.
Okay. Okay. So yes. So now, contrary to like you said, that first report was pulled from patients who have a history of depression, and this new thing that we're going to talk about, the survey was people taking psilocybin who may or may not have had a history of depression. Correct? That I don't know that that was controlled for, right?
Yeah, no, it wasn't. It wasn't. But so I would say maybe some people had an history of depression, so it was quite an uncontrolled sample.
But what did you find in that survey of people, like you said, whether or not they had depression, they were taking it more for just well-being
Yeah, yeah.
purposes?
So basically, it was like a big sample of around 250 people that took psychedelics in naturalistic settings. So, like, we looked at people going to ayahuasca ceremonies, to mushroom ceremonies in countries where these drugs are legal, to people also like having big psychedelic experiences in private settings, maybe nature or at their house, and all of that. And what we did was tracking these people for 6 months before and after the experience to see how their life and overall well-being was changing. And specifically for this arm of the study, we looked at their impact on their sex life, and we found very similar results to the one that we found in the depression study. So that people both at 4 weeks and 6 months after the experience reported improvements in sexual pleasure, in the capacity of communicating their sexual desire with their partner, in overall sexual satisfaction. They reported to be more satisfied with the appearance of their body. And interestingly enough, like people also reported to be more open to trying new things in their sex life. And this is not something that like we investigated further. I'm curious what that means. Like if people were just more open in general and like experimenting, or maybe like I don't know. There's all the story about psychedelics and polyamory that we are curious about. Then another one was also the people reported to see sex more as a spiritual experience. That is another one that I find overall fascinating, and we can expand on this later. But yeah, the results were significant at the 6 months follow up, and it's of course like an uncontrolled study, so we don't know if people in the middle had more psychedelic experiences or similar things. But of course, was another additional point in much bigger sample that kind of proved the results that were obtained in the small and more controlled sample. And again, like I would say, these results are quite preliminary, and the idea was just to kind of like throw a first stone in the lake and get some more attention on this and be like, okay, like this is something that is worth researching, because psychedelics might appear to have positive effects on sexual functioning, and like not just about not having sexual dysfunction, but they could actually make people sex life better.
Yeah, that's fantastic finding. And I was wondering if there, in those findings, did you see a difference between effects depending on what medicine they took?
No, we like it was something that we had a look at, and most people took psilocybin or LSD, and some people took ayahuasca. But yeah, we didn't like went much further into that. And similarly, like we look into the difference between males and females, and they were more or less comparable. Apart, there was just one that I think at 6 months stopped to be significant for females and remained significant for males. I think was partner satisfaction, but was a very small difference. But overall, they appear to be quite consistent across gender.
Interesting. Well, was ketamine one of the substances studied?
No,
Okay.
no,
Okay.
no.
Worth noting. Just because it's kind of an outlier in so many
Yeah,
things, right? Shorter duration of action and all of that.
yeah, yeah,
Um,
yeah. And the study was
yeah.
just, yeah, to mention, was just classic psychedelics. So
Okay.
psilocybin, LSD, ayahuasca, 5-MeO, DMT, DMT. So all the serotonin 2A receptor agonists.
Okay. And speaking of serotonin, before we get into the spirituality, which I wanted to tap back into, like you said, but you had mentioned that SSRIs tend to cause some sexual dysfunction because of the amount of circulating serotonin, if I understood that
Yeah,
correctly.
yeah, yeah.
Um, with these other serotonin acting, like the classicals, and then also with MDMA that, as far as I understand, causes kind of waves of serotonin. Why do you think that those have different effects, even though they're both involving
Uh-huh. Yeah.
serotonin?
So, like, if you think about like classic psychedelics and SSRIs, the big difference is that we found these effects weeks after the drug effects have been cleared from the system. So we didn't really look at how like the sexual functioning of these people was acutely impacted by psychedelics, but how like psychedelics induce long-term changes in their brain that then were related to improved sexual functioning later on. And this is a key difference, and I think also like is a key difference in general about like how psychedelics and classic antidepressants are administered, because one is more an episodic treatment that it might be taken every few months apart, while SSRIs involve taking a molecule at every time. And so yeah, I think this is a key difference that is related to this. And if we look at the acute effects, and again, like this is, I'm wildly speculating, but I think this is the right place to probably do these kind of things, because there's very limited research on the acute effects of psychedelics on sexual functioning. And there are some like preclinical studies in mice that look at serotonin 2A agonists and their effect on sexual functioning, and it was found that they had inhibitory effects in males, but an enhancement effect in female mice. And this is something that I find quite interesting, and it maybe could be translated into the microdosing space. I know that some people find microdoses of LSD to be sexually arousing. It's again, like I think people in these days say that microdosing helps with absolutely everything. So I wouldn't trust it until I see some more control data. But anyway, this is something quite interesting. And the other thing is that on the acute effects of psychedelics, there are people that report acute experiences that have a strong sexual connotation. So this is something that was never like has been never really investigated in mainstream research, but it's happened enough times, both in our trials and it's been reported in the qualitative literature to kind of like hint that there might be something of interest there. So that like people sometimes report this state of intense physical arousal that they tend to interpret quite like orgasmic or ecstatic, depending on the person. And especially like psychedelics like 5-MeO, there are definitely a lot of people that describe the experience to be very orgasmic in that sense. That is not physically arousing, it's different. It's more this feeling of like maybe a pure ecstasy and relaxation that then is interpreted in sexual terms. And I find it quite interesting as in a phenomenological way. But yeah, this is kind of just
You heard it here first. This is the place for wild speculation, as Tommaso said. That's my favorite. You're like, if there's ever a place for wild speculation, it's here. Yes. I appreciate that. I will take it. Come on with your wild speculations at any point in time, backed by science. And I love that you're like, yeah, they say microdosing can help everything, right? If you believe it, right? Ask Balash. As long as you
yeah,
believe
yeah,
that it will work.
yeah,
Which
but
which
yeah,
again is
yeah.
is useful. The placebo effect is an effect. So
Yeah. And again, like the old story, like the with high doses of psychedelics and this intense sexual experiences, like I've witnessed it happening first person by guiding psychedelic experiences at Imperial. So it's a phenomenon. I really don't know what's that related to. It could be some sort of very strong parasympathetic stimulation of your nervous system that then gives you feelings that are somehow similar to an orgasm. It could be, but it's not something that has any research on it.
yeah, very interesting. And we need what did the Kinsey or whoever
Yeah,
the people doing all the
yeah.
sexual studies back in the day. We need that department to combine with Imperial for a minute. So you mentioned briefly kind of the spiritual aspect that was being
Yeah,
reported in that survey. Can you talk a little bit about that?
yeah. And that's something that was quite an interesting result, and I kind of regret that we didn't look at that further, because it would have benefited of a bit more context. Because when people hear, okay, like you feel sex more as a spiritual experience, you might think, what does it mean? Like, did people like end up really doing like new agey sexy practices? Like, I don't think it's really about like heating up incenses while you're having sex or anything like this. But like, if I look at it and what it might mean, I think it's something to do with like connectedness and kind of like seeing sex in a way that is less mechanical and maybe a bit more profound, that people weren't used to that anymore. Because again, if you look at like spirituality from a secular point of view, is really linked to connectedness and how people feel connected to each other, to a larger whole, to like their communities, the universe, and so on. And so like, it could be that after psychedelics, suddenly like you start having sex and there's less a mechanical thing, but you start thinking more about like an encounter between two people that have like different stories and different vulnerabilities and different experiences, and it becomes something that is more personal. And I think this is what might feel like being more spiritual to people. Or maybe it could also be that people feel more into their body and suddenly like they feel sensations that maybe they weren't used to. So there's a lot that I think warrants further investigation in that dimension, but it was quite a curious result.
Yeah, that's very interesting. And it reminded me of, I think it was the Matt Johnson had done this study and his team about how many people had gone into their psychedelic journeys as atheists and come out with some more belief system. Maybe not, like a fervent,
Yeah,
super
yeah.
religious person, but maybe more agnostic or curious, or maybe like just generically spiritual, like you said, feeling more of a connectivity. And I wondered if there was some intersection there, like between that phenomenon, then just combining with sex.
Yeah, I think so. I think there's definitely like an interesting possibility on that, on that dimension. That again, I do want to like mix it and mix spirituality with like religion or like anything that is too like structured,
Yeah.
because yeah, I think there's always like when you do these talks and like around, people tend to like don't have a clear idea what that spirituality mean. But I think, yeah, what Matt Johnson was trying to like bring out was, yeah, this sense of maybe, yeah, possibly secular spirituality that it's just about like being more connected within each others and as communities.
Yeah, and speaking of connection, you had mentioned before we started recording that in addition to sexuality, you were looking into psychedelics related to intimacy. Can you talk a
Yeah,
little bit about what you're investigating there?
Yeah, so this is a bit like what we are now following up this research because it was quite fascinating, and I was like, okay, we really need to do more on this, and I still have quite a lot of time to be here at Imperial as of now. So I was like, okay, like I have time to develop this further, and this is what we are trying to do because I realized by looking around the research space that like there is nothing on the interpersonal effects of psychedelics in healthy people, and not even in MDMA. Like MDMA is known by everyone to kind of be a love drug and be something that can enhance feelings of connections, and people like use it in recreational settings all the time to like connect and like be more loving about each other. But if you look at like mainstream research, there is nothing on the effects of an MDMA on romantic relationships, and I was like, we need to look at this. It's such a massive lack of research that there is in the space. So we now launched this big survey study that is now running online, that is looking at couples that are taking MDMA or psilocybin or other classic psychedelics together, or they're going to a psychedelic retreat together, and couples will have to sign up in the system, and after they get a date to have the psychedelic or the MDMA experience, they're going to get some questionnaires before and after, up to 3 months after the experience, in like 3 different occasions, plus some questions on how the experience was. And we want to try to investigate the effects of psychedelics and MDMA on relationships dynamics and intimacy. So we are looking at things like relationship satisfaction, conflict styles, sexual intimacy, and love, and all these variables, as well as a lot of more situational variables, to try to understand what are the context that might be linked to an improvement or possibly deterioration of these relationship qualities. Because I think that if you end up, I don't know, taking MDMA in your private settings, maybe in your house, and use it as a tool to discuss with your partner something that might upset you and might not be best in the relationship, and try to do some intimacy exercises, the effect of in the improvement in the relationship might be much better than, for example, taking MDMA at a rave with your partner and really just dancing all day without really interacting between each other. So we are trying to understand these nuances of the phenomenon, and possibly like publishing about this in a few years down the line. And the study is online in the Imperial College website. So if you go into the Central Psychedelic Research website and you search for current online studies, you should be able to find it.
Oh, very cool. We'll put that in the show notes then. Absolutely. And it's funny that you mentioned that today the episode is being released and yours will be released next. Today's episode is MDMA couples therapy on the podcast.
Oh, great.
So, yes. So, we're first off, they're going to think we just took a wild delve in. So, we're going to do all of our love episodes in a row. But I dig it. So, yeah, we have somebody
Yeah,
on
that's
today
quite.
discussing MDMA couples therapy. So I love that it's being looked at from, because I think there's a study going on somewhere, maybe at the VA, that was mentioned that's
Yeah,
looking into to that. And then with your, because like you said, there's situational is different, and so your survey is different from setting up this, like
yeah,
clinical
yeah,
trial.
yeah, yeah,
um and I
yeah.
love that what your survey will look at is probably what more people will have access to quickly, if
Yeah, yeah,
you know.
yeah. And it also helps to like gather data on this phenomenon, and trying to like, the more data we get, the more we are able to understand it, the same that we did with psychedelics a few years ago. And another study that is like a smaller, now you mentioned MDMA couples therapy, we have a smaller branch of the study that is looking at psilocybin assisted couples therapy. Like I would call it more like psilocybin with psychological support for improving relationship quality, because we found this couples therapist and guide in the Netherlands, Sarah Tilly, that is basically working with couples that are distressed and unhappy in their relationship. And she designed a course together with psychological support to guide couples into a psilocybin journey in the Netherlands, and improve the quality of their relationships, working in what was not is not going well, and all of that, with the aim to improve whatever might not be working in the relationship. And given that we found someone that was doing this in these settings, we decided to collect data on these couples and or set up a low cost observational study of psilocybin for relationship well-being. And now we are collecting data on that. That is quite an interesting sample because goes into the distressed couples subsample that is quite fascinating and probably will not be captured as well from the big survey study.
Yeah, that makes sense. I will be interested to see if psilocybin and MDMA have similar effects because they're,
Yeah,
the MDMA, like as if you hear the episode that comes out today, we talk about so much about how it takes the fear center offline, which should hopefully make it easier to discuss things with your partner. Whereas psilocybin works differently, still works very well, but just a different mechanism. So if you just want to one last wild speculation, Tommaso,
yeah.
what do you think that we might see as differences between the two?
Yeah, that's a good point, and I'm really curious to know more. And what Sarah was telling me and how like the sessions are designed with psilocybin is that couples are taking a high dose of psilocybin, and then like they are having the experience in the same room, but they are separate, and they tend to have quite personal experiences. And at the end, they might like connect again and like talk and integrate the experience together, but they are not like the doses is high that they're taking, and they are separated. And it's quite different from how like MDMA couples therapy might be working on, that is reading based on dialogue and discussing things while you're under the effects of the drug. And what Sarah was telling me is that like she thinks that it works because it disentangles couples, and it's capable of individuating the two patients into the context of the relationship, so that like they start to develop a better identity in the context of the relationship instead of being completely fused into each other's and not capable of really like develop themselves and communicate their desires and what they want and all of that. So it's quite interesting. Like I think we are very very at the early beginning to understand how this molecules could be used in improving relationship quality, but it could be that MDMA and psilocybin work in two very different ways, and maybe could be useful for different couples and different issues. And yeah, I could definitely see that happening, but we still need a lot of research to investigate this further. And I'm not sure if how fast it will be to have a study in controlled settings that looks at like couples taking these drugs that are not couples where one of the partner has PTSD or anything like this, because I think ethically it's still a bit a tricky thing to do, and I know that yeah, it's not something that is too easy to do, but possibly this research that has been done now will help building up some evidence for the future.
Yeah, I think what you bring light to is that it's been much harder, seemingly, to investigate things on well people, because
Yeah.
usually we're trying to find something that we're getting further along to find a treatment for a thing, and just improving couple health and relationship health without having some kind of diagnosis associated is still a great benefit to each of the members of the relationship and society as a whole, if people are in happier, healthier relationships. But you're
Yeah.
right, it seems like it's more difficult when there isn't some kind of diagnosis involved.
Yeah, absolutely, absolutely. And I think like it's something that our like the medical system is slowly like approaching into it a bit more. If you and it's something that like becomes a bit more apparent with like the whole longevity movement and like trying to like preventive medicine and so on, that you don't need to be super sick in order to benefit from a treatment, while it used to be the case until very recently. And possibly psychedelics will end up better playing into this, but I'm still unsure.
Yeah, but I appreciate all the work you are doing to find out all of the ways that they can be helpful or useful for those with pathologies and those who just want to improve their lives. So, Tommaso, besides people going to your survey that you just mentioned, anywhere else that you're looking for people to fill out a survey or participate in anything else?
Now, like the main big survey that we are available is that one that
Okay.
is just around couples. The work that like Sarah is doing with distressed couples, it comes from her. side of work, so that people are usually get in contact with her, and if they want to work with her, then there is the option to participate in her study. That is like with the idea that like couples should go there independently, and they should not like enroll in anything as a consequence of like their interest in the research and so on, because we operate independently. And yeah, it's kind of like,
Sure.
but yeah, definitely if people are interested, they could definitely get in contact with her on that direction. And yeah, I think that's pretty much it. Like, I do a lot of science communication on my social media pages, so yeah, that's
Oh,
something that
yes.
I can mention too.
Tell us. Yes, please tell everybody where to find you.
Yeah, so I'm like on LinkedIn with Tommaso Barba. That is just my name, and I have similar account on Twitter, and is where I tend to post most of my psychedelic related content and share science to people interested in it.
Very excellent. Thank you so much for coming on and sharing all about this. And I look forward to all the more data that you're going to collect in all the different ways. And then we'll have you back on, and we'll do a follow-up episode in the future. How's that sound?
Yeah, that sounds perfect. Thank you so much, and that was a great conversation.
I enjoyed it very much as well. I will see you at the next who knows where in the world. and for every, and for everybody else out there, until next time. Thanks so much for listening to the Psychedelic Medicine Podcast. If you enjoyed what you heard, please leave a rating or review, as it helps others find the show. And if you'd like to learn more, you can find the show notes at plantmedicine.org/podcast, and there's information for clinicians at psychedelicmedicineassociation.org. Our incredible music was by the one and only Porangi. We'll see you next time.